Hey everyone, it's Janae, and thank you for tuning in to Daily Dental Hygiene. Today's topic is going to be one that I get a million questions about, and so will your patients be asking you. What's better, Oral-B or Sonicare? Well, as a full disclosure, I have both. I like both. I think they're incredible for different reasons. So let's dive on in and I'll go over everything with you. So first off, let's just take a look at them. They look pretty similar. The body, the base, they're rechargeable. This is the Oral-B. It is a circular toothbrush, and this is a Sonicare. It looks like a manual toothbrush. So good for different purposes, right? So these bristles for the Sonicare are longer than the bristles on the Oral-B. As you can see, your teeth are also circular, so the Oral-B definitely wraps and hugs around each tooth a little bit better than the Sonicare. I recommend the Sonicare when I see patients that have recession, embrasure spaces, and I'm seeing, the gum receding upward. I think that these bristles get in there a little bit better. I personally have a little bit of recession and some embrasure spaces, so I personally use the Sonicare. Now, Oral-B is incredible. It is a really, really, really good toothbrush for gingivitis, for braces, for just classic overall gum health. I think that this does a really, really good for the majority of the patients. This to me is a more specific toothbrush for recession and embrasure spaces, but I think they're both great, right? I am grateful if my patient even uses an electric toothbrush. So when I'm being asked which one I use, I both think they're incredible. If you have classic gingivitis and you're using the Sonicare, I'm not gonna say no to that. If I just had to deter them for which one does best, I'd like this more for gaps, spaces. I like this more for tight, puffy gums. But let's talk about some other aspects. So Oral-B, generally a lot cheaper than the Sonicare. If you're a Costco member or you go to Target, Oral-B is a lot more affordable. So that's kind of a price point why some people like the Oral-B. And you should see that in your patients, right? You kind of get to know them. You kind of know what they do for a living. Do they have a bunch of kids in college that they're paying for? So that's also something to kind of, bring up and mention. Another thing is the Sonicare is a lot more quiet. The Oral-B has kind of gotten the knock for being super, super loud and noisy. But they actually just came out with a new Oral-B IO. This is like the latest, greatest toothbrush. The only thing is it's really expensive. I think it's about $300. So definitely a more expensive toothbrush. I absolutely love this toothbrush. It's very quiet. It's very tech savvy. I think the bristles do an incredible job at cleaning, but it is $300. So different things that I love about both. Different things that your patients are going to be interested in. If money's not an option, that puts us in a whole nother ball game. A lot of patients are going to financially, be reliant on what they use. As much as I want everyone to get laser therapy and chlorhexidine and have $300 toothbrushes, I realize that sometimes that's not a possibility. So price point and what your patient needs is what you need to also consider. But I love both of these toothbrushes. I think they're incredible. Pick whichever one you like and, gear it towards what your patients feel like they need as well.